One of the things that I need to remember is that patients are hiring us to take care of their dental needs. So we can't really be wishy-washy about what we find. For the most part, if we see decay on an x-ray, we need to fix it because we know one thing happens with decay. It's right there in the word itself, decay. It will get worse and it will eat away more tooth structure. Individuals that are 18 to 25 years old, for the most part, don't have a lot of dental problems that they've had to deal with. What we need to do is make sure that they're comfortable now. They learn to trust us now and know that we're not there to hurt them. We want to take care of things so that if things occur as they get a little older or lifestyle causes some changes in their mouth, we're able to address that and fix it in a very comfortable manner. Well, if this is your first visit to our practice, we usually will appoint you with our dental hygienist, and the dental hygienist will help me by thoroughly charting your mouth, figuring out what types of restorations you have in your mouth already. She'll do a full periodontal evaluation by checking the depths of any pockets that may be in the mouth. And then she'll go ahead and do a dental prophylaxis, a routine cleaning. And when she's done with that, she will then get me to come in and I'll do that routine exam. Or if it's your first time, that first exam, we'll call it comprehensive exam. And we'll be able to check all your teeth, make sure that you don't have any areas that need to be fixed. I also will recommend that x-rays are taken, and certain x-rays that are there specifically to look for decay. We'll use them every year to kind of check where your mouth is. It's important that we evaluate and look at every other tooth. So if we find something like that, we need to go ahead and either do a filling or a crown or some kind of procedure to take care of that so that it doesn't continue to break away or eat away at the tooth. If there's something that's borderline, I'm willing a lot of times to wait a rotation, either till the next cleaning or till the next time we take x-rays, and try to figure out how fast that problem is occurring. Maybe we can wait a little bit to fix it. Maybe we need to fix it right away. LUF Dental stands for Look, Understand, and Fix. I think the understand component is key in building a relationship with you as a patient. As we get to know you better and we build that relationship, it becomes a relationship of trust. And then it's a little easier for me to tell you things that need to be done because you trust me. So I really value that relationship when you can build it, getting to know people and build that trust between two individuals.